The discussion is about depression and its symptoms at different stages of life. I have previously touched on these symptoms in adults, children, teenagers, and young adults. In this section, I will address some points regarding the symptoms of depression in old age for those over 65 years old. I want to emphasize that fortunately, contrary to popular belief, depression is less commonly seen in the elderly. The symptoms often attributed to depression in adults or the elderly are more likely due to a slower pace and a more tranquil lifestyle rather than being directly related to depression. First sign: depressed elderly individuals experience a type of confusion and disorientation. The issue is not just that they are lost, because if they were not confused, they might find their way or guidance. However, due to the confusion, the disorientation continues, affecting their mind in theoretical subjects and various practical aspects of life. Second sign: they may not recognize people or remember their names. Sometimes, even though they have known someone for years, they fail to recognize them, though they might eventually recognize them after some time. Third sign: when they leave the house, despite having walked the same path hundreds or even thousands of times, they can easily get lost. Sometimes, they fail to recognize how they moved, where they came from, or where they need to go. This results in problems with recognition and comparison, impacting their ability to identify issues in these areas. Fourth sign: they lack attention and concentration. They may suddenly forget what they were saying or get distracted by something else. They may also struggle to continue a task they were eager to do. Their attention and concentration significantly diminish. Additionally, they tend to repeat things, either unconsciously or because they want to maintain a conversation by repeating topics, as nothing new comes to mind. This can be more frustrating for others than for themselves. Consequently, they may struggle with learning, memory, or forgetting, sometimes not even knowing if they have eaten breakfast or lunch. Unfortunately, one common issue is that they forget whether they have taken their medication, leading to problems like overdosing or repeated dosing, which can result in serious complications or hospitalization. Therefore, elderly individuals' medications should be organized by themselves or their loved ones to ensure they take them only once at the specified time, avoiding the dangers of overdosing or repeated dosing. Fifth sign: a state of indifference and apathy. Due to depression, they may develop a kind of numbness or lack of emotion, which, although variable, can sometimes be so severe that they show no interest in or concern for their loved ones or close friends, even if they have been close for many years. Sometimes, even the death of a loved one has no immediate effect on them, although they might show sensitivity to it a few days or weeks later. In any case, a sign of depression in elderly individuals is their indifference and apathy towards various aspects of life. Sixth sign: excessive consumption of tea, coffee, or cigarettes. In some elderly depressed individuals' homes, tea and coffee are almost always available as a way for them to occupy themselves, even though excessive consumption can worsen their depressive state and lead to new problems. The symptoms I have mentioned for adults, children, teenagers, young adults, and the elderly should be consistently present for at least 2 weeks without interruption to diagnose someone with depression. If more than half of these symptoms are present in someone for about 2 weeks without interruption, that person is likely experiencing depression. However, if these symptoms come and go or appear mildly, the person might not be suffering from depression. But if for about 2 years, with less than 2 months of relief from these symptoms, a person shows a third to half of these symptoms, we recognize it as chronic depression or dysthymia, which many people worldwide suffer from. Unfortunately, we have a higher percentage of people suffering from this problem inside and outside the country due to cultural, social, familial, and educational conditions, despite being similar to other cultures and countries in terms of depression. As I mentioned at the beginning, another disorder is often seen as the opposite of depression, though sometimes they are somewhat related. This problem is called mania or euphoria, which some people suffer from. Although it is different from depression, most people with this disorder also experience mild depression, making them bipolar, experiencing both depression and euphoria. Let me touch on the symptoms of mania in adults. First stage and sign: a tendency towards grandiosity, seeing themselves as entirely different, superior, and more outstanding than others. In other words, manic individuals believe they are superior to others in various areas, feeling a sense of pride, arrogance, and greatness. Second sign: a significantly reduced need for sleep. They may function entirely on 3 or 4 hours of sleep per day and still have the energy and desire to carry out daily activities, thus sleeping less than others. These individuals are often less sleep dependent than others during their manic phases. Third sign: they have an excessive ability and energy for activities, sometimes twice as much as others. They engage in daily activities with the necessary energy, and despite their lack of sleep, they do not show a decrease in energy. In fact, they are more active than others. Let's continue this discussion in the next section. Also, don't forget to subscribe to our channel.